This is the Art Beauty Podcast where we are always reaching for truth and beauty. Remember, the brands on the show are not paying to be here, so we can ask the questions that we know you want answered because you deserve to have the best information so you can make the best choices for yourself. Hi, everyone. I'm Amber, and today my fabulous co-host is Dr. Jennifer Levine. She is a double board certified facial plastic surgeon operating right down the road from me in New York City. Welcome to the show, Dr. Levine.
Oh, thank you so much, Amber, for having me. It's always good to talk with you.
It is so great to talk to you. And by the way, I love your office. It is so
Oh, thank
like
you. Well, you have to
girly and
come because
lovely.
we expanded to the office next door, so now we have a beautiful OR suite and more exam rooms. So you'll have to come check it out.
I definitely need to come check it out. Today we are talking about the jawline, right? And how that can change the face. So let's just get right into this because I know we've got a lot to cover. And I know that you were busy operating this morning. You probably have patients later today. So let's talk about the jaw. Why is the jawline getting so much attention fairly recently? And what can that do for our face?
So personally, I have always been obsessed with the neck and the jawline because that really is what gives us a feeling of youth and really balances the face. So whether we think of men or women, for women, we like a more defined, narrower jawline than for men. For men, it's okay to have that squarer jawline like Batman. So having that definition gives like a really strong uh, energy to the face. And because the jawline is at the boundary between the face and the neck, it's really important for the overall balance of the face. So if we don't have good definition and strength there, it doesn't make our face look as good.
No, it's funny because I feel like this seems like something that is so obvious. And certainly for men, I know that, a strong jawline has been talked about for a
Mm-hmm.
while. But for women specifically, I feel like this has just come into the conversation in like the past couple of years. There's been such a focus to the jaw. Um, is it because there's new technologies? Is it because, or why is that?
I think for a number of reasons. I think that as we've moved through these different procedures that people know about, like as we introduce new products, at first there was a lot of interest in the upper part of the face because of what Botox could do. So everyone was talking about lines and wrinkles in the 11s. And then we had fillers for the nasolabial folds and then for the cheeks. So people kind of we're talking more about that. And now we actually have some new products that have been FDA cleared for the treatment of the jawline. So certainly those companies are making significant investments in kind of bringing that area to fruition. But as a surgeon, I have to say, like, the neck and jawline has always been a very important focus for me. So it's not new. It's just now we have some ways besides surgery to kind of address it. So I think it's getting some more attention.
I love that. So let's start with the non-surgical ways. What are some
Right?
of the ways that we can help either define the jawline, maybe tighten it up?
Yeah. So when we are thinking about the jawline, we always have to say, like, okay, what's going on here? So we want to know what's going on anatomically so we can address those treatments in the right way. So obviously we have bone. So we have the bone of the jaw and also of the chin. So let's say a lot of people don't have a very well defined bone or chin. And as we get older, we actually lose bone in both the mandible and maxilla. So that increases how this doesn't look as good. But often, a lot of people also who don't like their nose don't like their nose because their lower face is weak. So
Right.
using products such as RADIESSE, or there's a new product called Volux, and either one of those products can add volume and kind of balance out the face by adding volume to the jawline as well as the chin. So those are some products for that.
Okay, so those are two products that are great if we want to add definition to our jawline. But I know for so many people, we start to notice the jowls. Maybe there's a heavier neck. What are some great things that we can do to slim the jawline or to remove some of that?
Yes. So in the cases of when there seems to be extra stuff there, there's problems with the skin, there's problems with fat, And then there's problems with the deeper layer of connective tissue called the SMAS.
Right.
So if there is a big problem, then we want to have treatments that are going to address all of those things. So a couple of treatments that address that would either be ultherapy, which is micro-focused ultrasound. So ultherapy is going to target that deeper layer of tissue called the SMAS, and it's going to cause it to produce collagen and elastin, and that's going to lead to tightening and elevation. Then if another treatment for that would be evoke, which is sustained radio frequency, which is also going to tighten and gives the ability to also destroy some fat. And we also have M-face, right, which uses muscle stimulation with radio frequency to work on the elevators of the face, and that kind of picks that up. And then we have other treatments for the fat, like either like cool sculpting, sculpture, or Kybella.
Okay, so let's go back to the tightening methods. You mentioned that there were 3. Do you have a favorite?
I think it kind of depends on the individual person. So my personal favorite, if you really don't like your neck and you don't want to go under the knife, is ultherapy, because it's really the gold standard of lifting. So it really is the device that when you test it against the other devices really performs the best. So ultherapy would be the gold standard. If you're looking to really reduce fat, like I have a lot of younger patients that are that want to contour the lower part of their face and their neck, Evoke is a great treatment for that. And we've also seen great things with M-face. M-face doesn't target the jawline in specific, but because it's targeting the elevators of the face, by lifting the other parts of the face, the neck and jowls do really improve.
And I know with M-face is a BTL product, right? So we've got M-sculpt, and that really hit the market as the first, body toning, and they've got M-tone now. Is it a series of treatments that you need to do?
Yes. So M-face is a series of 4 treatments. They're each 20 minutes, and you space them between 5 to 10 days apart. But the great thing about it is there's no pain and no downtime.
Okay.
So
right. I've done L-therapy before, and L-therapy is amazing. I use it just for general, I try to get in once a year for general maintenance, collagen maintenance. I'm not really attacking a specific problem, but it's painful. It doesn't feel good.
I give people little numbing injections, so I make it not painful, but otherwise, yes, the temperature that's needed to actually produce the collagen and elastin is kind of hot. So you definitely feel it after a while, but it's worth it.
No pain, no gain, right? I mean, isn't that what we say?
For sure.
And then, so Kybella, I've heard mixed reviews on Kybella. I've seen incredible before and afters. I don't know anybody personally who's done it. But what are your thoughts on that? I know that one of the big side effects
is a good product, but honestly, you probably have less downtime with a submental liposuction. And there's a lot of swelling that can occur with Kybella, and you usually have to do it multiple times. So it's kind of hard to get people to be swollen multiple times. So it's not my go-to product. It definitely there are some people who are, they don't mind if their neck gets swollen and they're fine with it, but it's not my favorite procedure for under the neck.
You bring up a good point, and I don't want to digress too much, but a little bit, because I think that it's a good time to point out with a lot of these, less invasive, minimally invasive, or non-invasive procedures, you have to invest at the end of the day, sometimes a lot more time to get a desired result when, going under the knife can, one, I think, give you more, is it safe to say guaranteed results?
Mm-hmm. I mean, surgery is still the gold standard, and it's going to give you a definitive result, and you're going to have to do it one time. So if you have the ability to have surgery, then that's usually a good choice. It is not a good choice if you have no downtime at all, or there's some reasons that you don't want to do surgery. In that case, some of the other procedures are better, but when you add them all up together, they're certainly not going to be cheaper in terms of time or in terms of how much they actually cost, because these non-invasive procedures can also get expensive. Right. But it's not non-invasive procedures. We're not supposed to do them because they're cheaper. It's just more of a time save, that you don't have any downtime. You can go back to your regular activities. And some people really don't have the ability to have a surgical procedure.
And I guess no offense, it also depends on what we consider downtime, right? So I had surgery, I had a breast lift, and that was a week where I was like literally laid out in bed, couldn't even sit up by myself. However, I've done other of these sort of non-invasive things and suffered. I did Quo, which if anybody has listened to that podcast, it sounded amazing when I did it. It involved months of being so bruised that at times I couldn't sit on the toilet, and then had no result. So if you listen to that podcast where I was so excited about Quo, I just want to jump in here again. Don't do it, in my opinion.
Well, they took it off the market, so you don't have to worry about it.
Okay, great. You know, because it didn't work. But it's funny because when they were talking about it, they're like, oh, no downtime. And I just want to hop in here and say, you know, with these sort of minimally invasive, it depends on what downtime means for you, right?
Right. Well, I'm like, that's why I'm not like a believer in these like minimally invasive procedures. I either want to give my patient a non-invasive procedure that there isn't downtime, like all therapy, or surgery, because once you kind of give someone downtime, you're expecting a significant result. And
yes,
sometimes these like in-between procedures that give you some downtime, but they're not real surgery, are not going to give you a result that really is a surgical result. And I feel like kind of once you give someone some downtime, like you want to see a real change, like a little bit is not good enough anymore.
Amen to that. I know now we have discussed the ways to sort of add volume, ways to take away that are non-surgical. Is there anything else right now that we should be aware of before we get into the surgical options?
Well, we talked about ways to get rid of fat, which would either be a Kybella, which would be an injectable. We can get rid of it with cool sculpting or sculpture, which would involve either cryoliposis, something that made it very cold and you destroy fat that way, or sculpture that is using a laser lipolysis and heat to destroy the fat. So those would be other alternatives for the fat portion of it. So just to be
And
clear.
What about skin tightening? Is that the...
Well, skin tightening is very important because obviously if you take out the fat, the skin can actually be loose. So for very young people even, there could be some laxity after. So you have to be very careful in both your patient selection and in the procedure itself so that you aren't causing more laxity when you're taking out fat. But the quality and the texture of the skin, that's why things like alt therapy are very good, because that's actually going to tighten more and lift, which is really what most people want.
Okay, so now let's get into the fun stuff. What are some of the surgical, new procedures being done, maybe that we've heard of or maybe that we haven't?
So obviously there's, some mental liposuction, which really, is pretty minimally invasive because there's only like a little nick here, a little nick here, a little nick here. And you have to wear like a big dressing on your head for like a day and then a band for like a week. And you have to like sleep with the band for like 3 weeks. And that's going to really make a very significant difference in the contour of the neck.
Excuse me.
Okay. And of course, when we're talking about this lower part of the face, there's been all that talk about the buccal fat removal.
So tell us about that for people who might not know. What is that?
So for people who have like a fuller lower face and really want like that sculpted like Bella Hadid look, oftentimes there's extra fat in this area and you can make a little incision inside and take that out. And there's been a lot of like celebrities in the press and that people think that they've done it, or like Leah Michelle or other people. It's a tricky procedure because that same fat that you would take out in someone who's young is also going to be the same fat that you want to replace when you get older. So I would say like buyer beware. This is not a procedure for everyone. And you want to also think about what the long-term outcomes of this are going to be.
Which is so hard. So I look back at pictures of myself 10 years ago. I had such a round face.
Me too. My face was totally round. Someone would have looked at my face, or even I looked at my face, and I wanted it to be more sculpted. And sure, like someone would have said, you need to take out buccal fat. But if I look at my face now, I don't have any fat there.
Right. And I'm so happy I didn't, because I've never had cheek filler, like all of this stuff that you would do in here. Like, so I'm glad that you're saying buyer beware. And also to anybody who's a younger listener right now, your face is going to change. So just yeah, be
But
really
we have
careful about that
ways that
one.
we can safely contour the
Right.
lower part of the face for younger people. That might be a better option where they could feel like their face looks a little bit less round, but they're not burning any bridges.
Right. So what are some of those ways?
So usually it involves like multiple things. So depending on the person, you might do some like masseter Botox to narrow the jawline. You might have to do some chin filler. We might want to do something like evoke to these areas to kind of sculpt that. So usually it's like a combination of treatments to kind of get that in a more narrow way, but something that's fully safe and is going to allow them to age well.
Yeah.
I don't want to have people in a position where they're trying to fix problems that they had from old surgery. It's not my idea of fun.
Now, I was blown away. I'm not going to mention who it is, but a friend of mine who I saw recently, who's young, in her 30s, and I was like, oh, something looks like a little bit different. Got a chin implant, and this was a woman. You know, I always thought of chin implants for like, you know, like the Donald Trump wannabes, right? Like somebody who needs that big sort of strong jaw, but I was blown away.
Well, that's why, because this facial balancing is so important that, yeah, like a lot of people would benefit from chin augmentation, whether it's a chin implant or chin filler or jawline filler. It really balances the face.
Are you seeing a lot more women come in for things like chin implants?
Well, yes. I mean, I do a lot of rhinoplasty. So something like 85% of people who seek rhinoplasty would probably also benefit from a chin implant. So we usually do discuss the chin for that reason. But yes, I mean, a lot of people are doing chin filler or jawline filler if they're not ready for surgery. But yes, I don't think that people usually come in. Like there are a few people that have come in that are specific that they want a chin implant, but usually there's something else that bothers them. Maybe they don't have enough definition to their jawline. Maybe they feel like their face is saggy. Like there could be other things that are bothering them. And once you kind of show them in their pictures that it's really because their chin is not projected or long enough, and then you correct that, then you can make a real difference.
I have to ask you, you know, we did years ago, we did a piece for New Beauty, a video for New Beauty where we did a vampire facial together, which was amazing. And I remember you had that insane camera that took those crazy pictures of the face and then kind of put it in 3D, correct?
Yeah.
Do you still have that?
Yeah.
That was so cool. So that, you know, I guess it's a really cool device for you to have, because maybe if you are showing, here's what we're going to augment, but maybe here's how here's how the whole face would change if we're not just doing this, but we're also doing this. It's very, very cool. What do they call that?
It's just like a 3D camera.
Okay.
I mean, we have the Camfield one, and it's the Vectra system, but there's many other ones.
It's very, very cool. Is there
I
anything else, you know, surgical right now that you're seeing, or are there any new technologies?
Well, I think that what most people have to realize is if you are a little bit older, you having a submental liposuction may not be enough. You might actually need to have either like a mini lift, because if you take out fat, the skin and the underlying tissue will still be saggy and may actually look more saggy after you take out some of the fat. So submental liposuction is often not enough for many people who are seeking correction of their neck. So we always have to maybe do a little incision, and there's many different types of lower face lifts, neck lifts. There's many different approaches, and really it's like an anatomically based approach. So we want to have something that works with the individual anatomy of the patient.
Right. And I guess, you know, like you said, it's going to be so dependent, but, you know, if somebody was thinking, oh boy, I really think I want a neck lift or a mini lift, what is sort of the general downtime on something like that?
So you're looking at about 10 to 14 days of downtime. Really, okay. I would say I've had people go to a restaurant like at a week with some of this, like, especially if you have hair and it covers some things. The restaurant's dark, you could be fine. But in daylight with someone that you don't want to know that you did anything, you want to probably give yourself a couple of weeks.
Okay. Hey, listen, and that's, but
we're seeing more people tending towards these lifting procedures as opposed to getting volume in their face. So we're seeing that people don't want their faces volumized. There's this whole tendency more to like that's why we would call it like fit face, that you want to have like a sculpted look to your face. You don't want it to be too full. And you want it to look normal.
Right. Absolutely. So any other, is there anything, we've talked about these fabulous in-office procedures, anything that you recommend to your patients that we can kind of do to maintain or to extend our necks as long as we possibly can before needing some of these treatments?
So I think like an ounce of prevention is worth a pound of cure. So I think like what you're doing with the old therapy is really smart. We know our collagen and elastin production goes down 1% per year. All therapy is a great way to build collagen and elastin. So something like that is going to make you look better, but it's also going to maintain what you have.
Right.
So, and we want to treat these deeper layers of tissue. So I think that, a lot of times people think it's just about the skin, but we're three-dimensional people. We have many layers and they're all connected. So we have to understand that we might have to do multiple procedures. Another treatment that I really love for the neck is, any of the neuromodulators like Botox, Daxxify, all of those things, because this muscle here, the platysma, pulls the face down. So by adding some neuromodulators, it can actually lift the lower face and also smooth some of the bands. So that's like a fast, nice fix. And that's also something that prevents. So for people who are like, well, what can I do to make myself look better and age better? Like neck neuromodulator. Love it.
Is great. Now we did a podcast on Daxxify. Have you gotten your hands on any? Have you gotten to play with it?
No. We've had to, we have been Daxxifying lots of people.
What do you think?
Well, I think it's a very interesting product. So because of that peptide, the onset of action seems to be faster and it is smoother. It looks smoother than some of the other neuromodulators. I think, do I know that the product lasts 6 months? I wouldn't say that, but it might last longer than some of the others.
Oh,
it just depends on how it's
insider
placed.
tip. And is it much more expensive?
It is more expensive. It's about, like, depending on who you go to, about 1.5 to 2 times as much as regular neuromodulator.
So
it's more of like a special luxury product.
So like overall thoughts, like, for the regular gal, maybe like, should we just stick with our Botox?
I think if you're happy with your neuromodulator, and I think it's necessary to really switch. But if you kind of are feeling that it's maybe not lasting as long or it's not giving you the effect that you want, then I think it's worth to try Daxxify.
Amazing. I love getting these insider tips from you. You have all the fun stuff.
I think Daxxify is fun. Like, I think you have to try it for yourself.
Okay, well, I'm going to have to make a call and see if we can get some of that. So I'm going to have to figure out if I can get some of that and try some of that. Dr. Levine, it is always such a pleasure to have you on. If people want to come and see you in New York, if they want to see more of your fabulous before and afters, if they want to learn more about your practice, where can they go?
So they can go to my website, which is drjenniferlevine.com, or on Instagram, it's Dr. Jennifer Levine. And DM us, send us messages. We'd love to hear from anyone. Questions, concerns.
I love that. And of course, if you have any questions you want me to pass on to Dr. Levine, I'm always happy to do so. You can email us at hello@artbeautypodcast.com. You can find us on Facebook, Instagram, and YouTube at Art Beauty Podcast. I want to thank you so much, Dr. Levine. It's always a pleasure. And as always, we'll see you next Tuesday, maybe with a better looking jaw. Bye.
Bye.